Hello everybody, this is Dr. Kevin Connors and welcome to the 3 Phases of Lyme course. So this course is going to really go through my book, maybe in greater detail, trying to give you the most recent information that we have on how to really help you take care of yourself, especially in the 3rd phase of Lyme. So little bit of background into myself. I had Lyme multiple times, and then figured out through the course of seeing patients with Lyme that there were really 3 phases. I came up with that idea, I don't know, a dozen years or so ago. So if you hear anybody else talk about 3 phases or the 3rd phase of Lyme, they got it from me. Not that I'm, bragging about that, but I really realized that there is this 3rd phase that people always talked about, chronic Lyme, and oh, I have chronic Lyme and I can't get better. Well, I realized that there is this 3rd phase of Lyme beyond chronic Lyme where you really have an autoimmune disease because of the Lyme pathogens. So when I say Lyme pathogens, when I talk about Lyme, I'm not talking about just Borrelia. I'm talking about any smattering of co-infections that could go along with Borrelia. So understand that through this entire course, if I'm talking about Lyme, I'm talking about Borrelia and or the co-infections, because there's just too many things that can be going on with Lyme disease. It's never just one bacteria. So this 3rd phase of Lyme that we're going to talk about in this course in detail is that autoimmune phase, and that is the more difficult one to treat and which causes so much grief for patients, because every time they try to treat it, they're stimulating their immune system and causing more problems. So this 3 phases is the phase 1 I call the acute stage Lyme. That's the acute infection. Phase 2 is what would be called chronic Lyme. And then phase 3 is this autoimmune phase of Lyme. A lot of people who say they have chronic Lyme, they've had it for multiple years, they really may be in phase 3 in an autoimmune state. So by definition, phase 1, and we'll go through these through the modules. But in definition, phase 1, the infection is still in the blood or the tissues. It has not yet entered into a cell. That is the difference between phase 1 and phase 2. The infection has not yet entered into the cell. And when I talk about the infection, we're talking about the pathogen, the Lyme and or its co-infections. So these bacteria, these viruses that go along with Lyme disease, that we classify as Lyme disease, are infectious agents. They're pathogens. And they start off and are introduced into the tissue either by a tick bite, get into the bloodstream, circulate around the bloodstream, and your immune system should be sparked to kill it. Now, a lot of people get Lyme disease every single day and never really get sick because their immune system was able to kill the pathogen. That's what your immune system is supposed to do. So there's people that are getting Lyme, maybe tens of thousands of people that are getting Lyme on a daily basis, and their immune system is killing it, and they never even know what the word Lyme means or hear about it because they never really got sick. But when our immune system isn't able to kill it, it continues to reproduce, replicate in the bloodstream, typically in the tissues. And if one of these pathogens gets inside the cell, then that's what's called chronic Lyme. So that's how I define chronic Lyme, is that the pathogen is entered into the cell. It's much more difficult to kill now because your immune system does not go intracellular. So your immune system, you have macrophages, T cells, and other natural killer cells that kill pathogens. That's what your immune system does. Your immune system doesn't detox toxins like pesticides. Your immune system kills living organisms that are trying to invade your body, either that you consume orally through your gut cavity, or that you breathed in, or that were injected in you via some sort of tick or other vector-borne illness. Now, those pathogens got in the tissues, get in the blood supply, should trigger an immune response, and your immune system should kill it. If they're fairly virulent, your immune system isn't able to kill it before it's replicating quite quickly and getting into other tissues. And once it enters inside the cell, so it crosses in through the cell membrane into a cell, now it's kind of outside of the control of your immune system. If you can think of your immune system as like a bunch of police officers that are trying to kill the bad guys, as soon as that bacteria or virus goes inside the cell, the police can't go in there. It's like a border. The police don't go in there. So your immune system is not getting in there. They have the ability to now replicate without any really consequences inside the cell, and that's what is chronic Lyme. And so even if you do take antibiotic or specific nutritional that's going to spark a better immune response, you're not going to kill the things that are inside the cell. And then phase 3 autoimmune Lyme is defined as now one's immune system is making antibodies against one's own cells. So this might take, from phase 1, I just got bit by a tick, to phase 2, literally could be days. Most of the time it's weeks or months. So you have a window of opportunity of treating with an antibiotic if it's bacterial between phase 1 and phase 2. And that's what I did for my Lyme. I recognize it as Lyme because I got so deathly sick in phase 1. Now some people don't. That's the problem. They never get sick, but it really is still replicating in their body, and your immune system is not taking care of it. It's getting inside the cell quite quickly, and then that becomes a major problem long term. Now, I was able to recognize my Lyme disease quite quickly because I got so deathly sick, and I took an antibiotic and I killed it. Now, you don't just need to use antibiotics, but if you know you have phase 1 Lyme, a bacterial infection, using an antibiotic is a wise thing. So if you're in phase 1, I recommend antibiotics, but we're going to talk about that detail through these modules. That's a window between phase 1 and phase 2. There's a window. And then there's another window between phase 2 and phase 3. So back to the window between phase 1 and phase 2. I know I'm talking fast. We'll go over this in detail. But the window between phase 1 and phase 2 could be days, could be weeks, could be months. And then the window between phase 2 and phase 3 could be weeks, could be months, could be years. So a person could be in phase 2 chronic Lyme for years and then are still able to manage it and correct it through immune stimulants, through herbal immune stimulants, through supplemental immune stimulant, and they can manage it and treat it that way. If that window closes and you move to phase 3, meaning your body's making antibodies against self-tissue, completely different treatment program. You have to change everything. And we'll go over this in detail. So autoimmune phase 3 Lyme is your body is making antibodies to self-tissue. You are making antibodies to your own cells. Which ones? Well, could be any. So really it's going to be where that bacteria or that co-infection is more populated. That's the most common thing. So where you have more population of that co-infection, let's say it's your thyroid gland, then you could end up with Hashimoto's. Let's say it's other tissues, your gut, you could end up with a colitis and an ulcerative colitis and a Crohn's disease. So it just depends. You're going to have an autoimmune disease that's named after the tissue that you're creating antibodies against. Many times, most people, the greatest percentage of people with autoimmune disease don't have a named disease. They just have the symptoms of autoimmune disease, but they haven't yet gone through the diagnostic process to actually get a named disease. We don't want a named disease. We do not need a label. We just need to treat the autoimmune issue, and that's what this course is going to be about, is to help you guide you through that. Oh, a lot of information. That's why I wanted to make a course out of it, to help you walk through this. and to help you really be able to start taking care of yourself and looking at yourself a different way, that you're not necessarily, having these symptoms for no reason, nor are you having these symptoms that no doctor has been able to figure out and discover. Doesn't mean that you're crazy. So this is really going to be a self-help course for you to take this information and to self-apply it. And I need to stress that the purpose of this course is a self-help course. You're not going to be able to call the clinic and have a meeting with me and us take you on as a patient. That's probably not going to be able to happen. We are too busy with cancer patients in our office. And so that's the big reason why I created this course, is to help take care of Lyme patients without having to take care of Lyme patients. And I just wish I could clone myself and be able to help more people. I just can't do that. So this course is to be able to maybe clone myself into you, and that you can take care of yourself. So I'm going to try to give you as much information so that you can self-care in this. Not that you don't want to use a functional practitioner that lives near you and can work through these things together. But the problem that we hear from people is that I can't find anybody that knows what to do for me. I can't find any truly Lyme literate doctors, or doctors that are literate in autoimmune diseases and things like that really know how to take care of me. Well, you can take this information that you're going to learn in this course and maybe self-apply a lot of it, and then get help from a functional doctor that's near you. That's our goal in this. We're going to give you a lot of guidance through different ideas. So the guidance through ideas is going to be a work in progress. So we're going to be adding new stuff all the time to this, because there's new things that come up and new information that come up. But we're going to give you some ideas, because there's no perfect way to, here, all you got to do with phase 3 Lyme is do 1, 2, 3, 4, 5, 6, and you're going to be better. It just does not work that way. There's too many side factors that can be going on that make your problem unique. And we're going to talk about a lot of those side factors and how to deal with those. So there's going to be a lot of education on self-care in this course, so that you can take that information and be able to work through it. So you have to be able to study. You really do. Or if you're a person that's like, oh my gosh, the EMFs from my computer, I can't watch this, I can't do this, then you're going to have to get somebody to help you and do the studying for you and help you apply this information. Because wisdom is really the application of knowledge, right? So I'm going to try to give you as much knowledge as possible from the wisdom that God gave me, and then for you to be able to apply that knowledge to yourself. That's the key. And like I said, we're going to have new information in this. We're going to have new modules that are going to come up. Right now we're going to have 7 modules. We're going to add multiple new modules that are going to be able to help you as I learn more information, as I put more information together for you, as we talk about those other pieces that are unique to you and others in your struggle with an autoimmune Lyme and chronic Lyme. We're going to be adding modules. So understand this is a living course. That's what I call our courses, our living courses, because I feel like one of my roles is that as God gives me information, God gives me knowledge, my application of that knowledge, aka wisdom, is to then convey it to other people so that they can better help themselves. One of the major reasons why I'm doing these courses, I believe we're moving into an era that self-help healthcare is going to be necessary. We are moving into an era where doctors and the medical profession are basically completely governed through the nutraceutical institutions that are out there. And if we really want to help ourselves, we need to, and I mean all of us need to, learn more about our conditions, our bodies, and how to take care of it ourselves. This is going to be crucial in the days ahead. So take this course, keep coming back to it. A lot of you I know are going to be really educated already. You've had Lyme for a long, long time, and you could teach this course. So I apologize for maybe rehashing through things for people that are in that category. But know that I'll be constantly adding new information as I gain new information for you to be able to make choices that are going to be best for you. As always, know that I'll be praying for you. I pray that, and I ask that you guys pray for us as well. What we do is not favorable to the medical community, and they're constantly attacking us. So continue to pray for our protection and pray for our ability to continue to try to help people. All right, blessings to everyone. I hope you enjoy the course, and I just hope that it's a blessing to you. Bye-bye.